Doc Talk, sponsored by Geisinger Holy Spirit.
And as the state tries to reopen hospitals, hospitals are also trying to return to some semblance of normal. And as CBS 21's Ed Russo explains in this week's Doc Talk, they're also trying to balance normalcy and precaution.
Hospitals have taken major proactive steps to prevent overcapacity. Now that the curve appears to be flattening, hospitals are able to return to some level of normalcy while still making safety a top priority.
So we're going to be expanding clinic hours, and that would sound like it's a way to get more people to come into clinic, but actually what it is it's a way to stagger people's arrival in clinic so that we don't have people arriving at the same time, so we don't have people in the waiting room. We want to get people right into an exam room, not go into a waiting room at all if that's possible. And more importantly, to give a chance for the rooms to be cleaned in between patients.
So instead of all doctors working the same normal 8 to 5 schedule, their schedules would be staggered. This would keep the clinics open longer and enhance social distancing. For example, a clinic may open as early as 7 a.m. and close at 7 p.m. Remember, the ER is always open for an emergency. It's the clinics that are expanding hours.
But when I say clinic, I'm thinking of things like, doctor's offices where you would go to see your lung specialist or your cardiologist.
And if you have a scheduled surgery, COVID-19 testing is still essential.
If someone has pre-surgical testing and tests positive, if it's possible to delay their surgery any further, that would be the proper course of action. If I test negative, all that means is that I was negative on that day. That doesn't mean that the staff will not take the same precautions, that the staff won't have the same protective equipment, that the cleanliness and safety still won't be an issue. Because really, I could become positive in between the time the test was done and the time I have my surgery, even if it's the next day.
And this is exactly why there's more value in a test that comes back positive as opposed to a test that comes back negative. And the determination on the need for surgery will be very patient-focused.
So keep in mind that there's not a lot of surgery that's really elective. So the surgeons will be in contact with the patients and will make determinations based on how the patients are doing, based on the patient's symptoms, whether they can be put off or whether they should be in the first tier to be brought back.
For this week's Doc Talk, I'm Ed Russo, CBS 21 News.